I am Dr. Chanchal Gupta, Head of the Department of Obstetrics and Gynecology at Asian Fidelis Hospital, Greater Faridabad. So today I would be discussing regarding vaccinations in pregnancy and lactation. Any pregnant woman is really worried with the newer diseases which are coming up. Her baby and she should not be affected because of those diseases during pregnancy. And she's even worried how to prevent those diseases, what are the preventive strategies, what are the vaccinations available, whether we have these questions, whether she can take these vaccines in pregnancy, which vaccine to take and which not to take. So vaccines are of two types, like with the live virus and with the dead virus attenuated vaccines. Live virus vaccines should be ideally avoided in pregnancy. Then what are the best times which vaccines can be given to a pregnant woman? Vaccines ideally should be avoided in first 3 months of pregnancy, that is up to 12 weeks of pregnancy, unless or until we need to wait, it is a dire emergency to give that vaccine. Otherwise, better to give after 12 weeks of pregnancy. The most common and most frequent vaccine which is given to a pregnant woman is a tetanus toxoid vaccine, which is given between, first dose is given between 16 to 20 weeks of pregnancy, and second dose is combined with a Tdap, that is after 26 weeks of pregnancy. So tetanus at 16 to 20 weeks and Tdap. Tdap is tetanus, diphtheria and pertussis. That is prevention of 3 diseases for a neonate when it is born till the neonate gets its own vaccines after 6 weeks of birth. So this is the second dose which tetanus, which is included in Tdap. Then flu vaccine is recommended to be given again in the second trimester to prevention of flu, and ideally in the month of October or in the flu season, and patients which are prone for such diseases, the respiratory diseases, should be vaccinated with flu vaccine. Hepatitis B can be given to a pregnant woman. Rabies vaccine, meningococcal vaccine can be given to a pregnant woman. Rabies vaccine is not contraindicated. It's if you have a dog bite or an animal bite. So to outweigh the diseases and the effects of the vaccine, rabies is recommended to be given during pregnancy. Now COVID vaccine, as you all know, we had a pandemic since last 2 years. So most of the time by now all pregnant women have been vaccinated, but still 2 COVID vaccines, that is first and second dose, can be given during pregnancy. And booster dose, few bodies have recommended, like American guidelines and Foxy guidelines, they say we can give third dose of booster, that is COVID, during pregnancy, but as such there is no recommendation from the Government of India. Now few vaccines which should not be given during pregnancy are that is human papilloma virus, that is for cervical cancer prevention, which is given to young girls and even any women below the age of 45, but should not be given during pregnancy. Measles, mumps, chicken pox, these vaccines are contraindicated during pregnancy. Now breastfeeding part, that is during lactation, as such no vaccine is contraindicated to be given during lactation phase. It can be given. When you are taking these vaccines, you can have the question is what are the side effects. So you can have mild pain at the injection site, you can have a mild low grade fever due to the vaccination. So these are simple side effects and which can be managed with some painkiller like Crocin, or you can apply an ice pack at the injection site. So no major effects of these vaccinations have been observed in pregnant women. So what I would suggest is these vaccines which I have told, tetanus toxoid, Tdap, flu or influenza vaccine, these are to be given during, this is a routine to give these vaccines in a pregnant woman, and should all pregnant women to be vaccinated during pregnancy.